Are we ready? Good afternoon. I'd like to begin today by thanking the mayor for bringing it forward and Tulsa City Council for voting last week to implement a mask mandate in Tulsa. I'm extremely proud of this challenging decision by all of our city leaders made towards lessening the spread of COVID-19 here in Tulsa, our largest city in Tulsa County. Even if masks aren't required where you live, we still strongly urge all Tulsa County residents to wear masks, to wear a face covering when in public. It does make a difference in reducing transmission, which is critical right now, and primarily because today we report an additional 112 Tulsa County residents who have tested positive for COVID-19, gives us to a cumulative number of 6,856 people who have tested positive since the beginning of the year. The good news is that 5,740 of those people have recovered. There are currently 1,027 confirmed active cases of COVID-19 in Tulsa County. Since our last press conference on July 8th, we have reported out an additional 17 Tulsa County residents who have died from COVID-19, bringing the total to 89 lives lost. Please keep those families in your prayers and your thoughts. A little bit more about data trends. I'd like to provide an overview from our data team, and this is information from July 12th through July 18th. We continue to see increases in new cases compared to the previous week. The average age of cases decreased to 37.02 years of age. The 18 to 35 group continues to be the group with the most cases, followed by adults 36 to 49. Over 75% of all cases in Tulsa County are in people below age 50. We saw the largest increase in cases for those aged 5 to 17, with over 18% increase compared to the previous week. The group we saw the largest, second largest increase in cases was the 0 to 4 age group, with an almost 12% increase compared to the previous week. While we had a decrease in hospitalizations last week, we did see an increase in deaths. The average age of those hospitalized also decreased. So 34% of all hospitalizations are in people under age 50. Within the week I've been referring to, which is the week of July 12th through 18th, new cases in Tulsa County were residents of Tulsa. 13% were for residents of Broken Arrow. Today I wanted to go over some facts and clear up misconceptions of some important actions when it comes to prevention of COVID-19. I think we need to get more clarity about how this disease works, or this disease investigation works. After you are tested for COVID-19, the entity where you got tested should call you with your results. If you got tested at your doctor's office, you should hear back from your doctor's office first. If you tested positive for COVID-19, a public health professional from Tulsa Health Department will also contact you. Since that very first case back in March, our epidemiologists and contact tracers continue to investigate all possible cases of COVID-19 amongst Tulsa County residents. A public health representative will check in on your health, discuss with you whom you've been in close contact with, ask you to stay home to self-isolate. They also contact the people with whom you had close contact to provide notification of a possible exposure. They ask if they have symptoms, and they offer guidance about testing and quarantine. Your name will not be given to those you identify as close contacts unless you give permission. It's important to be forthcoming with the contact tracers, as the information is vital to stopping the spread of COVID-19. When you receive an initial call from the Tulsa Health Department, the extension number may vary, but we'll start with area code 918 and then 595. If you receive a call on a landline phone, the caller ID displayed will be Tulsa Health Department. If you receive a call regarding contact tracing and you are unsure if it's legitimate, please call the Tulsa Health Department COVID-19 call center at 918-582-9355. Contact tracers will never ask for your Social Security number, bank information, or credit card number. Information gathered in contact tracing process is not used for any other person in the purpose and disease investigation. We've had a lot of confusion about what's the difference between quarantine and isolation when it comes to recommendations from our contact tracers. If you might have been exposed to COVID-19, you should stay home for 14 days after your last contact and monitor symptoms. That's called quarantine. Quarantine keeps someone who might have been exposed to the virus away from others to reduce the risk of exposure should they develop symptoms. You should isolate if you have COVID-19, whether or not you have symptoms. Isolation separates people who are infected with the virus from others, even in their own home. When you can be around others or in home isolation following being positive for COVID-19 depends on different factors. If you think or know you had COVID-19 and had symptoms, you can be with others after at least 10 days since symptoms first appeared and at least 24 hours with no fever without fever-reducing medication and with improvement of other symptoms, which is a change in the recommendation. That changes happened this week. If you had tested positive for COVID-19 but had no symptoms and continue to have no symptoms, you can be with others after 10 days have passed since your test. If you develop symptoms after testing positive, follow the previous guidance given or consult with your healthcare provider or visit the CDC for further information or instructions. By answering the call from the Tulsa Health Department and following recommended guidance, you're helping slow the spread of COVID-19 and helping keep other Tulsa County residents healthy. Let's talk about masks. There's a lot of information about wearing masks that's misleading or just plain wrong. I'd like to address some of the common myths and facts about face coverings. Myth number one, I feel fine, so I don't need to wear a mask. The fact is, recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms or what's called being asymptomatic. Masks or face covers help prevent people who are infected with COVID-19 from spreading the virus to others. Myth number two, the prolonged use of masks when properly worn can cause CO2 or carbon dioxide intoxication or oxygen deficiency. The prolonged use of surgical or medical masks can be uncomfortable. However, it does not lead to CO2 intoxications nor oxygen issues or oxygen debt. Myth number three, masks do not protect against COVID-19. The primary reason we're asking everyone to wear a mask right now is to protect those around you. But masks can protect both the wearer and others nearby from being infected by viral particles. Masks and social distancing of at least 6 feet have been credited with slowing the spread of COVID-19. A recent study showed that the daily decline in cases with states that issued a mask mandate compared to states that not. So wearing a mask does result in decreased transmission. It flattens the curve, which we're all trying to get to. It's important that when you have a mask to wear your face covering correctly. Wash your hands before putting on your face covering. Put it over your mouth and nose and secure it under your chin. Repeat, it should cover both your mouth and your nose. Try to fit snugly against the side of your face. Make sure that as doing that you can breathe easily. Public health officials recognize that wearing cloth face coverings may not be possible in every situation or for some people. In some situations, wearing a cloth face covering may exacerbate a physical or mental health condition, lead to a medical emergency, or induce significant safety concerns. Adaptations and alternatives should be considered whenever possible to increase the feasibility of wearing a cloth face covering or to reduce the risk of COVID-19 from spreading if it's not possible to wear one. If you're being tested for COVID-19, it's our recommendation that you should self-isolate while waiting on your test results, especially if you've been exposed. If you were exposed and you tested negative, it's important to stay home for the full duration of your 14-day quarantine, as the virus can develop anywhere from 2 to 14 days after exposure. Our recommendation has been to get tested 5 to 7 days following a potential exposure or attending a large gathering. The Oklahoma State Department of Health does not combine antibody test results with its regular COVID-19 viral test results on its dashboard. Tracking of that is done separately. Tulsa County data reported on our dashboard does not include the results of antibody tests as well. Tulsa Health Department does not conduct antibody testing. While THD and the Oklahoma City County Health Department are statutorily autonomous agencies, cases are required by state law to be reported to the Oklahoma State Department of Health and then assigned to the health department with jurisdiction for the county of which the individual resides. THD is the public health agency responsible for investigating reportable diseases for Tulsa County residents, including COVID-19. Numbers published daily are not necessarily indicative of a one-day jump, as there may be various reasons for a lag in reporting or classification of test results. This is why we often rely on, and we really stress, analyzing 7 or 4-day rolling averages so we can actually detect trends and patterns. When it comes to the THD dashboard, we try to be as transparent as possible. Our goal is to be first, to be right, and to be credible. Our data team pulls the daily information from the Oklahoma State Department of Health data files. We want to be clear that as new data becomes available, the counts may change accordingly. Each case represents a unique individual regardless of how many times they were tested. This is important because we've heard misconceptions that people are being counted more than once if they test positive more than once. That is false. If a business or organization has a positive case, a representative from the Tulsa Health Department will call individuals and facilities that have been exposed to a confirmed case to assess the risk and make a recommendation, including isolation and quarantine. That is done in collaboration with the positive case through contact tracing. Risk of exposure is dependent upon the situation and the type of employer. For example, a small business where employees work in close contact with one another may result in the need to close the business while the employees are quarantined and monitored for symptoms. In a larger company where the person who was positive was unlikely to have been in close, prolonged contact with every single employee, our quarantine recommendation does not apply to the entire company. Case investigation information is confidential and will not be released publicly by Tulsa Health Department. For example, throughout the response, our contact tracers may identify a workplace and will work with that workplace to make recommendations to notify employees at risk of exposure. The workplace may elect to make that information public, but THC will not release that information publicly. While we're still focusing on COVID-19 prevention, we don't want to forget that routine childhood immunizations protect against numerous other vaccine-preventable diseases. Routine vaccination, especially of infants, should continue. This ensures that our communities remain free of vaccine-preventable diseases and that individuals are as healthy as possible. If routine vaccination is postponed, we fear the community could be faced not only with the COVID-19 pandemic, but an outbreak of vaccine-preventable diseases like measles as well. At the Tulsa Health Department, we have seen a sharp increase in the number of clients that were seen this year compared to the same period, a sharp decrease in the number of clients seen this year compared to the same time last year. From April through June, we've only seen 21% of the clients we've seen at the same time last year. This is following the national trend as noticeable decreases in orders for childhood vaccines have been observed across the country. According to the State Department of Health, the school requirements for childhood immunizations are unchanged. All children 2 months of age and older must present an immunization record or file for an exemption before they are allowed to attend child care or schools in Oklahoma. We will continue to support parents getting their child back to school ready, whether that's virtual or in person. Clients seeking immunization services at the Central Regional Health Center and or the James L. Goodwin Health Center are encouraged to call 918-582-9355 to make an appointment. Measures have been temporarily modified to limit potential exposure for clients and staff while practicing social distancing. Oklahoma State Department of Health announced last week a significant change for vital records, moving from an outdated ordering system to an online service. The Vital Records Office is now able to provide lower convenience fees for online and phone orders, which results in faster service. The Vital Records Office at Tulsa Health Department James L. Goodwin Health Center has resumed limited in-person services by appointment only. Customers can schedule an appointment by calling 405-271-4040 or visiting tulsa-health.org. Again, we strongly encourage not to delay routine vaccines for your children and family during the pandemic. I can assure you that Tulsa Health Department and other healthcare providers are following local and CDC guidance to keep you safe if you need in-person care. Also, the immunization clinics get very busy as the first day of school approaches, so we are asking families to make an appointment to visit now while there's little to no wait time in our clinics. In closing, as a public health agency, our charge is to provide the guidance and recommendations to keep our community safe. Medical doctors treat each patient individually. Public health professionals work to safeguard the health of our community, and we do this in many ways, from inspecting food establishments to testing water to encouraging tobacco cessation to teaching healthy habits to school children to advocating for equitable access to healthy foods and safe neighborhoods. Our epidemiologists routinely investigate reportable diseases in Tulsa County, and our team of nurses routinely provide important vaccines to prevent disease outbreaks. I could not be prouder of the team of dedicated public service at the Tulsa Health Department for the work they do every day to keep our community safe, and for the extraordinary ways they have each stepped up and stepped in to help with this COVID response. Their efforts may go unnoticed by some and unappreciated by others, but everyone watching right now should know that the Tulsa Health Department stands ready to serve and keep Tulsa County safe. Thank you for your time. I'd like to introduce Mayor Bynum.
Thank you, Dr. Dart. And I want to echo Dr. Dart's gratitude for the team at the Tulsa Health Department who have just done a remarkable job through something that our city, has not been through ever. I know we talk about the Spanish flu epidemic a lot, but that was not in an age of mass communications, and in particular social media communications of dubious veracity. So I really appreciate all the work that they do. Speaking of gratitude, I am incredibly grateful for the courage that my colleagues on the Tulsa City Council showed last week in casting a vote to establish a mask ordinance in the city of Tulsa. You could see over the course of the day, through the dialogue that they had with local experts, the pendulum shift on that. There's been so much misinformation out there by people who copy something from another Facebook page that they saw, or they heard something from a friend who works somewhere else. And instead, the council brought in local experts. And they heard and received letters from each of our major hospital system CEOs in town talking about the need for this. They brought in the president of the Oklahoma State Medical Association, who is a Tulsa physician. They brought in other local and statewide experts, and then they listened to them. And after listening to those local experts talk from a medical standpoint about the importance of masks, it was a 7-2 vote. And so I'm, incredibly grateful for those medical experts taking their time to spend with my colleagues on the council to share their expertise. But also, again, I can't say enough, when you have people protesting in front of the building saying not to do it, to have a 7-2 vote, I thought was really courageous by my colleagues, and so I'm very grateful for their action and was happy to sign that ordinance about 12 hours later, early in the morning on last Thursday. I think it's important, as always, that we keep our eye on the data with this. And we've talked about, since we started the reopening process, looking at hospital capacity. And that is the driver that caused us to decide that we needed to move forward with a mask ordinance. We've largely, I think Dr. Dart and I have been at these, and Commissioner Keith as well, have been at these for months now, talking about the importance of wearing a mask. But it was never, we didn't get to the point where it was felt that it needed to be mandated until we heard from our hospitals, and they told us, we're getting to a point where this has to happen. And so I just want to put things in context here. When we started out the reopening process in early May, we had, I believe it was 14 people on May 9th in Tulsa County hospitals with COVID-19. Earlier this week, we had 185. That is the type of change that we're seeing and have seen just in a 2-month period of time here in our city, in about 10 weeks, relative to this event. And that's why it became necessary for us to take this kind of action to slow the spread of this virus. On the 21st of July, Tulsa County reached a milestone in that 1% of all residents of our county had at that point tested positive for COVID-19. The United States as a whole reached that milestone on the 13th of July. I cannot think of a time in the history of our city where 1% of our population was diagnosed with an infectious disease in a 6-month period of time from its origin. It's a remarkable rate of spread, and again, why we are encouraging the social distancing practices that we've encouraged, why we're enforcing the state guidelines around how businesses should operate, and why we felt it was necessary to put in place a mask ordinance. We will continue to keep an eye on hospitalizations. I've had a lot of questions about, what's next? Do we need to do something else? There was a possibly a White House report that was leaked last week, though it's never been presented to us by either the federal government or the state government, prescribing steps that maybe we should take here. I continue to work with my colleagues on the city council in evaluating what the data looks like and really looking to our local independent experts at the Tulsa Health Department as to what, if any, steps we ought to be taking. I think there is a belief and a desire that we want to see how this mask ordinance works and what kind of impact it has on our overall spread and our positive case rate, and of course, most importantly, our hospitalization rate. Speaking of the mask ordinance, just going around town in the last week, have definitely noticed a significant uptick in the number of people wearing them. And I'm very grateful for all the Tulsans that are doing that. I've heard from business owners that are grateful that the standard has been established. It's not on a business by business case as to who thinks somebody should have a mask on or not. Now it's just the law of the city, and that gives them some reassurance. We're happy to be the bad guy there. They can blame it on us. Also, though, I've heard from a lot of residents, and in particular, I've heard from folks who have not felt comfortable going out in public for 4 months. Heard from a lady that went to the grocery store this week for the first time in 4 months to get groceries, because she felt safe going out in public because most people had masks on finally. And so when I hear stories like that, I'm just very thankful for the Tulsans who are taking this seriously. And really, when you go around town and you see people with the mask on, it's really, in my mind, it's a symbol of the folks in this community who are taking this seriously. And I've definitely seen an uptick in that over the last week. I also think it's really important to remember why we're doing this. We've lost a nurse practitioner named Amy Williams this week to COVID-19. She was a mom of a young son, a wife. She was in her mid-40s. And I know that we did a great job in the early going of this pandemic, rightfully hailing the selfless actions of our healthcare professionals here in Tulsa. We need to be reminded that we should be doing that every week. There are so many brave people working in doctors' offices and healthcare clinics and hospitals all over this city who are treating our fellow Tulsans in need. And I hope they know how grateful our city is for their work and their bravery. Right now at the city of Tulsa, and we'll hear from Chief Franklin and Chief Baker here in a moment on quarantine levels in their sworn departments. Amongst our non-sworn city employees, we have about 55 different employees on quarantine at the moment. This is because we've established through our city medical office, and we did this back in March, very stringent program to quarantine any employees that might be suspected of having come in contact with somebody with the virus, so that we minimize any spread within our organization. I do want to thank the team in our city medical department, especially Dr. Berry, for all the work that they're doing that is allowing our very outward-facing organization to continue to do its work. Lastly, I do want to say on a personal note, these are not the same without Karen Keith at them. And I hope she knows how much this city loves her and that we're all thinking about her. And we can't wait to have her back at these briefings. Thank you.
Good afternoon. The Tulsa Police Department continues to operate without interruption to service. We currently have 60 sworn officers that are currently quarantined. 4 sworn officers have tested positive for the COVID-19. we have one TPR, or one reserve officer, that has tested positive for COVID-19. We have 24 officers that could be released and back to regular duty within the next 72 hours. Currently, Riverside Division has been the most impacted. Actually, Riverside Division and Mingo Valley Division share in that distinction with 15 each currently under quarantine. Most of our exposures and quarantines are due to off-duty exposures, not on-duty exposures. And those officers have brought that back into the workplace and into squads. Tulsa Police Department experienced as high as 88 personnel under quarantine, with the majority of those returning to work just this week. Again, those exposures were largely due to off-duty socializing outside of the police department. With that, we continue to look for the most effective ways to keep our officers safe and keep the citizens of Tulsa safe. We're working very closely with the Tulsa Fire Department and have been sharing resources, and Chief Baker will speak more on that, I believe. For the police department, there has been no remarkable increase in call volume to the police department in regards to the mask ordinance. And we want to thank Tulsans for that. We want to thank Tulsans for making our jobs easier just by simply wearing a mask in public. So with that, I will turn this over to Chief Baker.
Thank you, Chief. So give me a moment to get my notes together here real quick. So a few weeks ago, you saw me up here talking about the increasing number of Tulsa firefighters that were being quarantined in potentially impacting operations to the department. I will tell you that firefighters don't take that lightly. We want to be at work, and so being put out of the game is a big challenge for us. We also know that a large number of firefighters unable to, on backfill or other things, driving overtime is unsustainable over the long term of this. As we see an uptick in cases within the county, also those, much like Chief Franklin talked about, those begin to impact us as well. As a result, when we first noticed this change, I think I talked about it before, we reinstated a medical monitoring unit, which has become a data hub for the Tulsa Fire Department, and we have been able to give you some really good data. And I think what you'll find is, based on information and what we've seen with our own cases, we've been able to decrease the risk and change the way we quarantine and protect our firefighters and our public. So as of today, we have 65 firefighters that are on quarantine. And I'll give you a little bit of history. If you go back and look, our highest number of quarantined firefighters back on the 1st of July, right before the 4th of July weekend. And so that was 109. So you can tell the difference between 109 firefighters and 65. So what happened? On July 16th, we changed the practice of how we quarantine firefighters. And this is not something that we took on arbitrarily. We went to a CDC practice which says that if you're not a direct contact with an exposed individual, if you're a secondary contact, you could continue to work but be placed on what we call medical monitoring. And so that is, we developed a system of data collection with these individuals, and we've shifted folks that were off-duty to a medical monitoring situation, asked them to increase the level of protection that they have had in the fire station, but they're also completing temperature checks and data-recorded health checks multiple times per day on their shift. So they're able to continue to work. Where I can tell you today is that as of Friday, as we begin to change the way we practice and we work with the City Medical Division to clear members back to work, we will be down as low as 35 firefighters on quarantine. So as you can see, we are at a peak of 109, and we're looking at decreasing the amount on quarantine and increasing the amount on monitor. Once again, this is based on several different factors. First off, we have the data to show that these firefighters that we were putting off secondary to a direct contact, 90% of them were never developing symptoms. So we know that by visiting with them, talking to them, and gathering important information about their health status. Additionally, if we did not have a medical monitoring unit in place with fire department members who took it upon themselves to learn contact tracing and develop a system, we can gather this information, we can make real data-driven decisions about our operations. And last but not least, in conjunction with CDC guidelines that existed on fire and emergency medical services that we are conforming to, and are in consultation with Dr. Berry, the city physician, we've been able to make this adjustment. So as Chief Franklin mentioned, we are working with the Tulsa Police Department in updating how our processes work, helping them gather their data and information as well. So all that said is that we have made sustainable changes to the department. We are closely monitoring through data recording the status of our firefighters, and this is greatly impacting our ability to continue public safety delivery to the citizens of Tulsa. Thank you.
Now we'll take COVID-related questions only, and we have questions for Dr. Dart. Yes. Dr. Dart, we'll start with you.
With our cases going up, and people trying to find a testing site, we're learning about 72-hour waits, and then some of these places aren't getting results back until 6 days. Is it time to open up more? Is it time to open up weekend testing? How do we go about doing that?
The question too.
So the question about testing and the fact that we have such capacity issues now, such long wait times, and yes, we started this off, we had 24 to 48 hours return time. Now it could be 5, even 7, even longer, because the capacity at the labs, and 2 labs this week ran out of reagent. So, and once again, from supplies, we're all drinking from the same supply well. So yes, we'd love to be able to expand. I know the labs would love to expand capacity. They have to have the reagents and materials to do that. But more importantly, we have to have the bodies to expand capacity. So we can get the material, but we have to have people who actually run the test. So it's a complicated situation that I think communities all over the country are facing the exact same issue.
The president of the Oklahoma State Medical Association, I believe that's the right title, he tweeted today that a patient, I believe in Tulsa, had to wait 8 hours before he was able to get a bed. Does THD have any insight, or can you talk to us about capacity?
So again, really speak to Dr. Monk's tweet, but there's a question about hospital capacity based on a tweet from the president of Oklahoma Medical Association. And we do know, and the mayor talked about, I think, very eloquently, that hospitals are about, I think, I didn't look at the data until yesterday, or since yesterday, but they're about 88% capacity. And you know, when the average hospital stay for a COVID patient right now is about 7.5 days. But you know, it's just the process of bringing patients in and discharging patients, it's a lengthy process. And so we're not really as concerned, I'll be honest, we're not really as concerned about bed capacity, which is always going to be an issue in hospitals. I mean, they want to stay full. It's important that each hospital has the staffing to man each bed so that patients can be taken care of. And as you know, we're in a national nursing shortage, which has affected everyone, and so we're feeling those effects in Tulsa as well.
Dr. Dart, the governor used the word plateau to describe new cases. Is that something you're seeing here in Tulsa? I'm a layman, but the chart doesn't look like a plateau.
So the question is, are we plateauing the cases? As the governor indicated, we might be in Oklahoma. And Tulsa County, we are not. We are continuing to surge. You know, we've expanded testing as a community, as a county entity, long time ago, and we're continuing to see a higher percent of daily positives than we would like. But we know that it's telling us the virus is widespread in our community and the prevalence is extremely high. And as the mayor mentioned, we have 1% that's already tested positive, which is extremely unusual.
On the 1%, back early in the pandemic, did reference that the case count could be 5 to 10 times higher, and there's research that backs that, saying it could be 5 to 10 times, and sometimes 20 times higher. What would be a best guess, best estimate for Tulsa County of unconfirmed cases?
So, and that, so the question is, what's the best guess for unconfirmed case in Tulsa County? And, nationally they're saying that it's at least 10% higher. And I would imagine that Tulsa County matches that data as well.
Okay, we're going to move on to Mayor Bynum.
All right. Oh.
Surprised that other cities have rejected the mask ordinance instead of following Tulsa's lead.
Well, my hope is that my colleagues in our neighboring cities will engage in the same kind of due diligence that the city council did and invite local doctors and local healthcare leaders in to hear from them. Invite the leadership of our local hospitals and ask them for their guidance and what they need. Because the reality, as we've discussed in these briefings many times, is that the hospital system that we have in the city of Tulsa does not just serve the city of Tulsa. It serves this entire part of the state of Oklahoma. And so we are all very much in this together. I'm proud of the way the city of Tulsa is leading with this, but we're only in a position to lead because my colleagues on the city council listened to the medical guidance that they were given. And they took the time to go through that due diligence. If you'd, just to be candid, if you'd asked me what the vote was going to be last Wednesday morning before they had those discussions, I think it would have been very close, if not have failed, just because there's so much garbage information out there and distortions about the purpose of wearing a mask. But once you can cut through all that and hear from people who actually know what they're talking about and are trained and are professionals in the space, then it becomes much clearer. And thankfully, 7 of our 9 counselors agreed with that and cast a courageous vote.
Mayor, that alleged White House document, I know you said, and the health department said that they haven't heard anything from the state government or the federal government, but are the recommendations in there things that are on the table? I mean, they're pretty strict. They're limiting gatherings to under 10 people. They're closing bars, that kind of thing.
Yeah, so the question was about this alleged White House document that was leaked last week and it was online, but that has never been officially presented to us or I don't believe to the Tulsa Health Department by either the federal government or the state government. And are we considering the measures that are in there that they suggest, which they classify in the state of Oklahoma, I think it's Tulsa County, Oklahoma County, and Ottawa County as kind of the hot spots in the state or red zones in that document. And for red zones around the state, they recommend closure of bars, reduction of social gatherings to 10 people or less. Those are all things, by the way, that we've already done here in Tulsa at different points in this pandemic. And so all of that remains very much on the table based on the guidance that we get from the Tulsa Health Department and the need that we hear from our local healthcare community. But I will also say that I think for those of us who supported the mask ordinance, one of the key motivators behind that was that it is a hope of ours that this is a measure that's enough that it allows us to avoid those kinds of measures that are more harmful to our local economy. And we'll know, Dr. Dart would probably have a better idea than I do as to what period of time we'll know the impact of this ordinance and be able to see from the data what kind of impact it had on a spread rate. But that's one of the big reasons we did. But yes, everything, when it comes down to it, protecting the lives of Tulsans is the most important thing we do at the city. That's been our guiding principle throughout this pandemic, and it will continue to be so.
Can I have a quick follow-up, please? On the mandate, has there been a sit-down between TPD and City Hall? I know there was, because their legal counsel hadn't seen the Stillwater, I think, ordinance.
Yeah.
That ended up being passed, and there was some confusion over what violations would be.
Sure. So the question is about the early, I think, I'm trying to think of the right term to use here, but basically the lack of cohesive understanding throughout the city government on what this ordinance actually meant. And I think that the nature of that is really comes down to how it came about. We spent a significant amount of time working with the Tulsa Health Department and the Tulsa Police Department's legal team and our legal team within City Hall to put the draft ordinance together, presented that to the council. Councilors were uncomfortable with several provisions in that. They felt that Stillwater's ordinance more clearly accomplished what they wanted a mask ordinance to accomplish, and so they largely substituted the draft that we had submitted to them with Stillwater's ordinance and passed that. And I think that initial period of time immediately after that, there were some questions within the police department and within other areas of the city as to how it was to be enforced and who was to do what. I think probably the big difference between the two, and I think it actually ends up being a positive one, because my great concern in putting a mask ordinance in place in the first place was that you're asking our police department to regulate a population of, on any given day, about 1 million people who move through this city, and each individual, whether or not they're wearing a mask. And before that, in the early going of the pandemic, we were talking about regulation of individual businesses. You might have been talking about a few thousand when you take in all the exemptions that occurred with essential businesses and stuff like that. And so it just, on an order of magnitude, it is such a larger enforcement responsibility. The ordinance that Stillwater passed and that the council adopted and I signed really does not put that onus on an officer. Officers are not driving around town looking for somebody who doesn't have a mask on. Instead, it empowers property owners to tell people that that's the ordinance and they need to have a mask on, and if not, then they need to leave. And if the person won't leave, then TPD can enforce the trespass ordinance that we have in place. And if that's just one circumstance, we have a good FAQ on the City of Tulsa website that runs through a couple other different scenarios that you can see where the police department would get called. I think one thing that we haven't talked a lot about, but it's very important, is there are folks in our community who cannot wear a mask for a medical purpose. And so what you don't want is the police department getting called out because there's somebody who has a respiratory condition or post-traumatic stress disorder and can't wear a mask, and suddenly TPD is getting called out to deal with that. We don't want that kind of situation. And so I think one of the good values of the ordinance that the council did pass, and it shows the value of going through that process, is that you avoid situations like that, and it really turns it into more of a complaint-driven process.
Did you talk to the local hospitals about bed availability?
I talk with them every single week about it. Have I talked with the local hospitals about bed availability? Talk with them every single week about it. And it varies hospital by hospital. Some of them have seen a greater surge than others. But I do think, I mentioned it last week, but it bears repeating. The only reason that we are not having to do the kind of shutdown right now that we did in the early going of this is because the state of Oklahoma built a surge facility at OSU Medical Center with 124 beds in it. But that facility, to Dr. Dart's point earlier, is not currently staffed to deal with 124 COVID patients. And in this current environment, one of the issues that the doctors raised in the council discussion last week is, where do you find trained personnel, doctors and nurses, who aren't already in demand and aren't already being utilized in a different hospital, different facility? And so that presents a real practical challenge for that facility. But that is, at least right now, that the communication that I got from our hospitals is what caused me to change from trying to do a mask ordinance, and I think Dr. Dart would say the same, changed us from trying to get a voluntary compliance with a mask ordinance to realizing we've reached a point where this is something that we just have to do because our hospitals were telling us at the current trajectory of an increase, they could not sustain it.
Has your office received any requests for information from TPS as to how to move forward, and how are you as a dad preparing for school, starting just a month from now?
The question was, has my office received any questions for, I'm sorry, my glasses are, it's a tough time to be a guy with glasses, but for our friend here, I don't want to have my mask off. He's obviously within 6 feet of me. So I'll just keep venting here. Have I had conversations with TPS about return to school? The answer is yes. Members of my leadership team and I actually had a really good meeting with Dr. Gist and members of her leadership team yesterday, and they included a number of public health advisors, including Dr. Dart, to talk through their different options there. And I think they have a great challenge, and all schools do, in this environment, in trying to strike that balance between how you make sure that you're protecting children and how you're also making sure that kids are getting the education that they need. And as a dad of a TPS student, I was really grateful to see the very deliberate, thoughtful way that Dr. Gist and her team are going about evaluating their options on this. It gave me a lot of confidence in their decision-making process, and we're going to circle up with them again here, I think, next week to continue that discussion. Thank you very much.
Do we have any COVID-related questions for the chiefs? Chief Franklin?
You might have already answered this before, but we're getting a lot of people saying, why am I not seeing an officer wearing a mask? He's got somebody pulled over, give him a ticket, he doesn't have his mask on. Can you just reiterate what the...
Yeah, certainly. Officers, when convenient, should be wearing face coverings. But as a necessary part of our job, it's very difficult for us to communicate, and we have to be able to communicate effectively with people. Sometimes lives depend on that, and so restricting an officer by telling them that they must wear a face covering is not good for them and can cause additional issues, and I certainly don't want to put them in that position. So that's if you are out on the roadway attempting to issue a citation, the road noise and all of that, you take all of that into account, it would be very difficult for a person inside of a vehicle to understand what an officer is saying.
When you made your remarks, I just want to clarify something that you said in your initial remarks. Have you not received any calls for a mask incident yet? Or have you not issued any citations yet? Is that right? Did I hear that right?
Well, so we don't track calls per se. We don't break out what a call for violation of the mask ordinance would be. When those come in, they are not given a specific code because we don't have that in the code index file. So we look at, and we have been tracking our numbers, our call volume, and the call volume, had it increased the day that the mask ordinance went into effect, we would start seeing those numbers tick up. We have not seen that. That's why I said we've had no remarkable increase in our call volume. We have received calls, but again, you're not going to be able to find data on a person or an officer that issues a citation as a result of a mask, because we will not write it under the mask ordinance. It would go under the trespass ordinance.
Chief, is that statement still accurate from the department about you'll only respond to calls from business owners? And just a quick follow-up to play devil's advocate,
It's not a call just from business owners. It's anyone who has standing. So, in other words, if you have or at your residence and you want someone to leave, they won't leave, then you call the police. It's the exact same thing. It doesn't matter what it's for. It's just like a business that posts a sign that says no shoes, no shirt, no service. If a person comes in with no shirt and they tell them to leave and they won't leave, they're going to call the police, and we will come out and we will issue a citation or make an arrest for that trespass violation. So that's where we're at specifically with this ordinance. The ordinance itself, you won't see a citation written on, but you will see a citation that could be written on something that spawns from it.
I misspoke. I meant to say property owners. I'm sorry about that.
Yeah.
But still, does that mean a business owner could just choose, I'm not going to require masks and I'm never going to call TPD?
Well, I think that's a good question. I would have to defer back to Dr. Dart and what the health department has laid out, and if that is a violation from that level.
Follow up on that. Do we have any other questions for Chief Franklin?
Has the discrepancy early on been cleared up? Or are you still waiting for legal guidance on those other issues that were mentioned in that press release?
Well, we think things are cleared up, but I will say that when we initially when this mask ordinance started and the mayor made the proposal to the council, that was done in direct direction with Tulsa Police Department. We know that we have to have some type of penalty in order to, for an ordinance for us to make that enforcement. So again, this ordinance is one that really we have to go by other ordinances because it references that, because there is no specific penalty for it.
I know Mike Mirabine has a follow-up on that, I believe.
Just on the question about the business that knowingly doesn't enforce it and even is brazenly open about not enforcing it, that is something that we looked in, and Stillwater did a really good job of outlining the potential of that situation as well. And that is one where the Tulsa Health Department utilizes their contact tracing program. And if we find, and that was before the mask ordinance was put in place, though, brazenly violating it really, I think, helps draw attention to specific businesses. But if we find that there is a business that is just continually popping up and is clearly a public health nuisance during this pandemic, just as it would be if it were serving unsanitary food, that business is subject to being declared a public health nuisance and being shut down. Thank you.
Okay, and any questions for Chief Baker?
One question for Chief Baker.
Okay.
Chief, you've mentioned that a lot of your positive cases are after work on a recreational thing. Have you had any cases that you know of where someone has walked into a house with a COVID person or given CPR to a person that may have had COVID and that's how they contracted it? Or has it all been outside activities after work?
So the question is have we noticed that our cases of members that are positive or that are quarantined, are they from an outside off-duty activity or are they related to the job? A couple of statements on that. We do not have any direct knowledge of any patient that has transferred the virus to a firefighter in a response to a medical emergency or any other kind of emergency. Secondly, it speaks highly to the quality of personal protective equipment and the practice that we have in place to wear it on scene. We are also limiting the number of firefighters that go into a known screened patient. So that is filtered at the dispatch center through IMSA and fire, and we are advising our crews. So we are seeing an uptick in the patients that we are receiving that notification that there is respiratory precautions advised, but we cannot correlate a direct conversation with that. It's the same kind of, I believe Chief Franklin said the same thing.
Do you know of any kind of restriction? Is there no map come out right now?
So-
Everybody needs that? Is there,
So for the Tulsa Fire Department, we do not do mouth-to-mouth in general, COVID or no COVID. It's just not part of our protocol. We use assistance devices to ventilate patients. So 911 center dispatchers will train and talk through someone in hands-only CPR. We know that that is effective, and that in this case, it was even more important. So until we arrive, there is a phone-guided CPR messaging that goes on by the callers.
Harrison, do you have a question?
Yes, a question for both chiefs. Actually, what kind of socialization was it where the firefighters and police officers were exposed?
I'm not sure. I think, some of our conversation early on, it may have been some members that attended a wedding. It's just, the outdoor social contact or contact with a friend. I'm having the same problem Mayor had, fogging up my glasses there. So we're just seeing that, we have to, there are parts of the employment that we can ask them to do, and parts that we have changes we can make within the station environment. And so we have been working with our members to continue to educate and understand how to apply the same public social gathering and restrictions and mask wearing on their off-duty time. So.
Just to verify, as far as you know, there's not been any on-duty exposures.
So when you say on duty, so we have had members that have been exposed to each other, but it's an on duty versus to a patient or another kind of emergency response is no.
And Chief Franklin had to step out to another meeting, but you can follow up with their PIO. Okay, thanks, everyone.
Okay, thank you.